Welcome everyone today to the Maya seminar here on April 21st, the day before Earth Day. And thank you all for participating. I think we have a very interesting seminar today, and I'm glad to see that our announcement has gone out and we have many participants today from across the university and some from outside the university perhaps. And so I want to welcome you all. This is our weekly seminar, and we have a variety of different kinds of presentations. And of course, this semester we've been talking a lot about viruses and viral aerosols, topics that are close to my research interest and have become very timely. And this week, we have a very special opportunity to learn from the experience in South Korea. One of our doctoral students, who you see here, will be presenting. Jin Song is a PhD student in Maya. Her advisor is Mers Outbreak, and she has been working on climate change and air pollution interests. And she's now home in her home city of Daegu, South Korea, where she went back home recently. And she's going to tell us a little bit about her experience of traveling during the pandemic, leaving Maryland and changing planes and getting home, and what that was like, and about how South Korea has responded to the pandemic. South Korea, with a population of 50 million people, has about half as many cases as the DC metropolitan area. Even though they had some early, very strong introductions with super spreaders, they have managed to bend the curve and flatten the curve. And I am very interested to hear how they've done that. And so in addition to giving her presentation, she's also going to share with us a video interview that she did with my longtime colleague, Kiyoung Lee, who is now Dean of the School of Public Health at Seoul National University and an expert on indoor air environment and air pollution. So with no further ado, I want to turn it over to Jin to give us her talk today. Thank you.
Thank you. My name is Hyeonjin Song, and I'm a first-year PhD student in the Department of Epidemiology, and I'm also in Maya group as my research interest is environmental epidemiology. So currently I'm in South Korea, arriving on April 12. So it's about more than a week ago, and Dr. Milton suggested me that it would be good if I can share my experience and introduce how South Korea is responding to COVID-19. So I became to have a presentation today. So I'd like to talk about my experience from the airport to home about testing and self-quarantine. Then I'd like to introduce how the Korean government is responding to COVID-19. So I'll focus on publicly sharing information on confirmed cases and mask distribution system. And lastly, I recorded an interview with Dr. Kiyoung Lee, Dean of the School of Public Health in Seoul National University. The interview is about the current situation in Korea and lessons from the Mers Outbreak in 2015 in Korea. So to start with my experience after the spring break, I was living in a student apartment, and I avoided going out as much as I can, but I had to go out for the groceries, so I felt very anxious when I walked through the hallway and before using the elevator. And also I had to worry about saving enough food and commodities such as toilet papers. And yeah, also it was difficult to purchase masks. I ordered a box of masks through Amazon, but it took more than a month to get them. And also I thought about what I should do if I have symptoms. I had no idea which hospital I should go and how I should get there because I don't have a car. And also I was worried about the hospital charge, even though I have a health insurance as I'm working as a TA. I had no idea how much I have to pay if I become to need an emergency service. So even though I knew that the risk of infection is very high at the airport and in the airplane, I thought it would be more safe to go back to Korea because the situation is getting better there. So after talking with my parents and my advisor, I decided to go back to Korea and stay there until everything gets better. So this is the timeline from the Incheon airport to home. So first, at the immigrant check, all of the international arrivals had to get a body temperature check and fill in the health declaration form. And also everyone had to install an application called Self-Quarantine Safety Protection app. So I'll show this app later. And currently, the Korean government is focusing on managing international arrivals because these days, many cases are from the overseas. So if the incoming passenger have symptoms, that this passenger must get a test right at the airport. And if the result is positive, this person should be transferred to a hospital. Or else, if the passenger just have negative results or doesn't have any symptom, then they are just required to be under self-quarantine for the 2 weeks. And I'll explain how the government manages this self-quarantine. And since I didn't have any symptoms, I didn't get a test at the airport. And after the immigration check, there were buses only for the international arrivals who take the train. So I took the train Gwangmyeong station to get to Daegu. And at the train station, the police officers guided the international arrivals to the train. So what I found interesting was that every train had designated cars for the international arrivals at the end of the train, as you can see in this figure. And also there was empty car next to the car, designated cars to prevent the contact with other general passengers. So finally, arriving at Daegu station, the police officers guided all the international arrivals to the walkthrough test booth. So after filling the form, I got a nasal and oral swab tests. And then after the test, there were taxis for the international arrivals. So as you can see here, all the drivers were wearing this protection clothing, and the passenger seat and the driver's seat was separated with this plastic curtain. So finally, I arrived at home at midnight. And the next day, or at around 4 p.m., I got this message from the local health center notifying me that my test result was negative. And also during the 2 weeks quarantine, I must report my everyday symptom using this app, Self-Quarantine Safety Protection app. So this is the app that I had to install at the airport as soon as I arrived. So using this app, I have to report my symptoms twice a day, morning and afternoon. So in using this app, I have to check if I have fever or coughing, sore throat, or shortness of breath. And all of this information will be delivered to my designated health center officer. So also every day, this designated health center officer calls me to check up my status. And also this app uses my location, as you can see here. So use my location information so that the officers can check if I'm really staying at home. And also in Korea, there is a COVID-19 call center 1339. The government highly recommended people who have symptoms to call this number first before rushing to the hospital because that might infect many other medical staffs. So this call center gives direction on people, what they should do and where they should go when they have symptoms. So during the quarantine, the officers from the local health center visited me and gave me a box of this self-quarantine kit. So, sorry. This is sponsored by Samsung, and I heard that many different companies cooperate with the local governments to sponsor this kind of self-quarantine kits. So in here, I got some food and also hand sanitizer and 10 masks and also a thermometer. So after the 2 weeks self-quarantine, I have to visit the local health center to get a test again. I think I'll be getting the same type of tests, nasal and swab test. So this was my experience, and now I'll introduce how the government is responding to COVID-19. So this is the graph showing the number of new cases in South Korea. Between January 19 and February 18, South Korea had recorded a total of 30 cases and no death. But this slow increase in infections soon changed it. From February 18, there was 31st case. And after that day, within 10 days, there were more than 2,300 cases. And this patient 31 was known to be as a super spreader, because even though she had symptoms at that time, she participated in a religious gathering with thousands of people in a big church hall. So this super spread occurred in Daegu, the fourth largest city in Korea and where I'm living now. So until April 19, about 7,000 cases were confirmed in Daegu. And this number is very large, considering that the number of population in Daegu is about 2.5 million, but that of Seoul, the capital city of Korea, is 10 million. And about 50% of the cases in Korea were related to Shincheonji, the religion that was related to the 31st case. And this is the response system of Korean government, central government, including KCDC and the local municipal governments. The Korean government could rapidly contain COVID-19 because of the experience from the Mers outbreak in 2015. So in 2015, Korea experienced a sudden and unexpected outbreak of Mers, and this was the largest outbreak outside of the Middle East and led to 185 cases in South Korea. So at that time, the government was criticized for the lack of testing and withholding of the information, such as patient location and which hospital had confirmed cases. Because the government withhold this information to protect the privacy of the patients and the reputation of the hospital, there were some cases that people just visit the hospital without noticing that the hospital was contaminated. Also, even a fake list of the contaminated hospitals was spread via social media. So this MERS outbreak led to a firm belief that aggressive testing and information transparency should form a central part of any response to a viral epidemic. So after the MERS outbreak, the National Assembly of Korea passed revision bills relating to epidemic prevention and quarantine laws on February this year. And the bills amend 3 legal acts: the Infectious Disease Control and Prevention Act, and the Quarantine Act, and the Medical Service Act. So this act allows the authorities to fine suspected patients who refuse testing and patients who do not abide by quarantine or hospitalization orders, or to impose a prison sentence on them of up to 1 year. Also, this act allows the government to restrict exports of medicine, medical equipment, and other key materials necessary for quarantine and treatment, such as facial masks and hand sanitizer. And also, this amendment empowered the investigators. So the investigators can interview the patients and try to gather information, emphasizing that this affects the health and safety of the entire population. Then, to fill in the information gaps and also for verification, the information such as GPS data, surveillance camera footage, and credit card transactions are used to recreate their routes a day before their symptoms showed. And only places where there were close contacts or infections that could have spread are shared with the public. So this is the government website of Seoul. So this webpage shows the information on the confirmed cases in Seoul. So up to April 17, there are a total of 621 cases in Seoul. So there are 2 cases here, and for these people, it shows the contamination route, date of diagnosis, residence, and hospital. So for example, this case, the 621st case in Seoul, this person is from the overseas US, and on this day, April 15, this person arrived at the Incheon airport at 5 p.m. and went to the Gangnam Health Center to get a test at 6:30, and at 8 p.m. this person arrived at home. And the next day on 2:30, this person got a positive result. And for this case, 620th case, this person is thought to be contacted the case number 10,054. It also shows the timeline. Oh, and I forgot to tell that this information is only available for the cases occurred in previous 10 days. So which means that this person's information will be blocked after the 10 days of the date of diagnosis. And also the municipal governments also send real-time emergency alerts telling where an infected person has been and when. So for example, this alert is from Yeongdeungpo district. A second case confirmed in Daerim 3. Please check the Yeongdeungpo district website for more information. And another alert from Goyang City Hall, a confirmed case in Jugyo-Sik-dong. This person is under self-quarantine and will be sent to a hospital, and sterilization in this area is complete. So further information will be posted on the City Hall webpage. So based on this publicly shared information from the municipal governments, some people began to develop maps showing the date a patient was diagnosed with COVID-19, along with the person's nationality, age, gender, and where they visited. So this map is one of the maps that many people have been using, and it was surprising that a group of undergrad students developed this map. So this map shows the places where the confirmed cases visited when they visited. So here the red color indicates that the confirmed cases visited these places within 2 days. And orange color means that the confirmed cases visited this area more than 2 to 5 days ago. And green color means that they visited more than 5 days ago. So if I click this area, it shows that this place is Jungo Health Center, and there were total 2 visits recently at this time. And also this map shows the information on the cases. For example, in Gangnam district in Seoul, there were a total of 60 cases. So if I click view, it shows all the information of the cases, including their gender and their age. And also if I click the routes, then it shows where and when this person visited. And other than this, so one of the other remarkable reaction of the Korean government is that the 5-day rotation system for mask distribution. So to deal with the critical shortage of masks, the Korean government contracted with several companies that manufacture masks and distributed them to pharmacies in the whole country. So people are only allowed to purchase 2 masks per week on designated days based on their birth years. So for example, I was born in 1992, and because the birth year ends with number 2, I can purchase masks only on Tuesday. And if I couldn't buy masks during the weekday, I can purchase them during the weekend. And the price of the masks is fixed at about $1 per mask. Purchases are monitored through the government system to prevent multiple purchases. And also the government is providing mask inventory data of pharmacies as an open API to help developers launch apps that notify inventory statuses of pharmacy masks. So this is the mask map showing the pharmacies around my location. So green color means that these pharmacies have sufficient masks, more than 100 masks. And yellow color means that they have more than 30 masks, and red color means that they have less than 30. And gray color indicates it's sold out or they have no information. So this map helps people not to waste their time and effort to find pharmacies that have enough mask inventory. So lastly, I have an interview video with Dr. Kiyoung Lee, and he explained the lessons from the Mers outbreak and the current situation in Korea. So as I mentioned in my presentation, South Korea was the site of the largest outbreak of Mers outside of the Middle East. So what happened during that outbreak that influenced how South Korea responded to SARS coronavirus 2? Like what early actions, even before the act passed in late February, were different this time? Was this new act necessary, and if so, why?
Yeah, the last time we had this outbreak was Middle Eastern respiratory syndrome. And we had a large number of cases. One of the main characteristics was at that time was hospital infection. So most of infection was occur in hospital. And so at that time, we did not have this inspection station located outside of hospital. So patients tend to come in and infect other people, especially healthcare workers. So this time, because of this lesson, during this COVID-19, we established this outside inspection station right away. And then we were able to protect healthcare facility. And that's a first lesson that we learned from Mers case. And also at that time, we had the Infection Protection and Control Act. And that act had some process to protect the people against the infection. However, we were able to identify many problems. So right after outbreak, the Congress and government prepare revision of the act. However, that revision didn't happen. So we still had the old act until this time with COVID-19. And March of this year, Congress finally passed. And there are several little bit more stronger protection mechanism in the new act. Therefore, we were able to apply this system from April. I think that's it.
Okay, thank you. So the next question is about the mask use. So was wearing a mask common in South Korea before this pandemic? What has been the attitude toward mask wearing in South Korea over the last 10 to 20 years?
Yeah, actually, generally, South Korean didn't like to wear mask. Usually, wearing mask is it has been associated with some kind of criminal. So people didn't like to wear a mask. And during the Mers case, we were able to protect several cases by wearing this mask. And then at that time, people Korean understand that we need to wear mask to protect from infection. So I think the lesson from MERS, one of the major lessons from MERS is that people tend to wear this mask against this infection. So at the beginning of this COVID-19, one of the key protection mechanism was to promote wearing masks. And at the beginning, actually, people didn't like it, but it was easier to convince Korean this time to wear a mask. And then the problem actually was we didn't have enough masks at the beginning of this COVID-19 case. So people actually demand more masks, and government and industry were not able to provide enough. But I think Hyeonjin will explain the distribution system. So we now have a relatively stable distribution system to provide the mask nowadays.
Okay, great, thank you. So, and the next question is also about the Mers outbreak. So during the Mers outbreak, South Korean researchers were able to detect and culture the Mers coronavirus from air in a hallway outside of patient room that had a temporary negative pressure system installed. So has this evidence of the potential for airborne transmission via aerosols influenced policy in South Korea? And so, Dr. Lee, I know that you are an indoor air quality and air pollution expert. So have you seen any evidence of short or long-range airborne transmission of SARS coronavirus 2 in Korea?
Yeah, actually, during the MERS outbreak, our approach was mainly this transmission is not airborne, but more of the short range transmission. So we trying to protect this infection from this short range airborne transmission. And this time with the COVID-19, people still asking question whether this is whether there's a potential airborne transmission, especially like a different floor, if there's a possibility of transmission through ventilation system. So far, we had several cases in outbreak in a small area, and most of this evidence suggests that the contamination or infection through ventilation system may not occur yet. So we most of our evidence do not support that COVID-19 is transmitted through airborne, especially a long range or ventilation system.
Okay, thank you. And the next question is, so what has been the impact of COVID-19 on South Korea economy? Unlike countries such as Italy or Spain, where huge increases in cases were met with countrywide lockdowns, I understand that South Korea never imposed a curfew or stopped people from going to work. So how was using the public transportation and public facilities affected? And were many restaurants and shops closed, or what has been the impact on manufacturing?
Yeah, officially, Korean government did not have any curfew or stopping people to walking. But during this outbreak, especially at the beginning, number of cases was very small. So people tend to just behave as normal, and their behavior was more of cautious, but they didn't change much. But numbers, I don't know exact date, but number 31, the case number 31 is the turning point of our Korean outbreak. At that time, the number of cases was significantly increased for several days, and the number actually went up to almost 950. And then, even though government did not officially provide this curfew, people tend to change behavior right away. And then we stop gathering together, and people do not go to shopping, and especially restaurant, and many business were affected by this change of behavior. So maybe it's less than Italy or Spain, where they actually shut down whole system, but still South Korean economy, especially business, are affected by this COVID-19 seriously. And so Korean government provides some kind of relief fund, but most of people believe it's not sufficient. So, and also manufacturing, Korean manufacturing is very significant. And this is not my area, but most of information I'm reading from newspaper. There are two aspects. One is people who is infected by this COVID-19, and the business has to shut down, the factory has shut down. But another aspect is the supply of parts. So when they have a manufacturing, they need the supply of many parts, but sometimes they don't have some parts, so they had to stop manufacturing. And according to newspaper, the car manufacturing industry, it has to shut down because they didn't have some parts to make automobile. So overall, South Korean economy has a serious impact, even though we didn't have a complete shutdown.
And what about the public transportation? Like, did they have reduced schedule for metro or buses?
Actually, during this outbreak, we did not reduce subway. Subway is one of the main system. But a number of people who is using this subway and public transportation was reduced. And after a couple of weeks, actually local government decide to shorten operating time. So in that way, people can go home earlier and also reduce the infection probability of these public transportation workers. So, and also I actually took several times, I took subway several times at the beginning of this episode, and number of passenger was significantly less. And also another one is public transportation, like a train to Daegu. I think Hyeonjin is located in Daegu area now. The number of passenger was significantly less. And the whole this movement of this population during this episode, especially when we have a peak, it was reduced significantly.
Thank you. And the last question is about the telework. So I heard that even though all classes at Seoul National University were moved to online, that the campus is not shut down, so faculty and staffs don't have to telework. So how does this work? And are there any restrictions on who comes when? And is there any social physical distancing requirements or restrictions or research labs?
Yeah, now I'm Dean of Graduate School of Public Health. Every day I worry that our facility may have some kind of infection case. But fortunately, so far, we didn't have a case. Officially, SNU, Seoul National University, is not closed. So the workers has to come with a little bit flexible commuting time. And faculty and student, we ask faculty and student to stay home. We are not, we are not forcing them to stay home. We ask strongly that they need to stay home. But many faculties and some graduate students come to school. For the teaching, all teaching now is online. We had to delay beginning of semester from March 1st to 16th. And we start online course from March 16th. And at that time, we said we're gonna do it only 2 weeks. But after 2 weeks, we changed the policy. We're gonna continue 1 more week. And then now we declare that we will continue online course until we decide not to do it. So that means whole semester is more likely will be done by online course. The problem is there are many courses that require practice. So now university administration is working on how to accommodate those classes, because some of this practice is linked with their license. So if we have lack of this practice hour, then they were not able to get this license. So those things, we are working on it. And the social distancing, actually we ask people to keep this distance, but the problem is a research lab, and we have a relatively small space, and people still doing a lot of research. And so we generally provide this general guideline, but each lab, each professor is developing their own strategy in, to minimize this infection. So that's how we are doing right now.
Okay. So this is the end of the interview. And for his mention that Koreans were not likely to wear masks, I think he forgot to tell that people began to wear masks quite recently due to the air pollution. So it is true that in the past, people didn't like to wear masks, but since around 2015, the concern on the air pollution was growing, and it was common for people to check the air pollution alert every day and wear masks. And also for me, I also used to keep a box of masks at home. So when I check the weather forecast and if the air quality is very bad, I used to wear a mask, and I could see many people wearing masks. So in Korea, wearing mask was very common from the beginning of the COVID-19 outbreak.
Start.
Okay, so thank you, Jin. That was really a great presentation, and I think the interview with Dean Lee was very helpful too, because we're beginning to grapple with some of these same questions of how do we open laboratories and what methods will we use to protect people coming in to work. Thank you, Jin. That was really great, and I want to throw this open now to questions and discussion. I think that point you raised at the end there was important, because I noticed in the chat some people are saying, well, when I was there, people were putting on dust masks because of the dust. Yeah, we had, I think you had a little chat earlier that was beginning to be true. So that may have helped people accept the idea of wearing masks more during this outbreak than had been true previously. So, okay, Jessica?
Hi, everybody. So first off, Hyunjin, did you say that you are in Daegu right now?
Yes, I'm currently in Daegu now.
So mad respect to you for presenting this at midnight.
Yes, it's almost 1 a.m. now, but it's okay.
Yeah, well, I mean, I lived in South Korea for almost 2 years and maintained my public health professional activities. So I found myself doing that a couple of times, like, phone calls midnight, 1, 2, 3 in the morning. So I just wanted to make sure that everybody knew that you were up late at night presenting this, which I think is super cool.
Thank you.
This, I guess, I mean, I would invite your commentary, but this is less of a question and more of a comment. And I was really keenly interested in this presentation because I've actually done some work on South Korea's responses, particularly with like epidemiologic control, but to different diseases. And my primary focus is on HIV. So one of the things that's really been of interest to a lot of international commentators, in addition to noting that South Korea has comparatively done a really excellent job of keeping their case numbers down, is what they're calling like radical transparency. And what radical transparency means, as you mentioned, is posting like very detailed location, demographic data, and whereabouts of people that have either been exposed to coronavirus or actually diagnosed with that. And I went to the national website and you can see everything from like age to nationality and stuff. So for a disease that you can catch and get sick with and recover from, it strikes everybody as sort of, well, it's invasive, but it's a necessary evil because people can protect themselves. Flip that on its head and imagine what that looks like for a disease like HIV, which is incredibly stigmatized and you can't ever sort of get rid of. You can, manage it. But I just, I wanted to point out that this issue of privacy shouldn't be discarded because it's not necessarily the case that people won't face discrimination based on a disease like this, and I'm thinking from the perspective of like, I worked as an English teacher there. So, these private academies, if anyone can access your information because it's posted online, then that means that your employer can see whether you've contracted coronavirus. And they're thinking that the students' parents can maybe figure out based on the data that's posted that you contracted coronavirus. And if you get enough parents screaming at the school, they'll, revoke your visa and give you the boot and deport you. So that kind of thing is really, I think that's really overlooked. There's been some commentary on it, but I feel like we need to be paying more attention to the human rights aspect of what we call radical transparency, because this can create real problems for people.
Thank you for that perspective on it. And so it really becomes this tension, I think, as Jin was putting it to me when we were preparing this discussion, between privacy rights and rights to know, and that have a big impact on how one goes about controlling infection. And some of what you talk about, I think, is not just the, what happens when people know, but it's like, what is the government response to that? And how do we use the information? Is it used to protect and reduce transmission, or is it also used to discriminate in ways that we wouldn't want to see happen? So, Amir, you're on.
All right. Thanks, Jin, for such a fantastic presentation. This was really, really helpful, at least for me. It's really, I learned a lot of things here. I don't know how much you are paying attention to what's happening in the US this week, and starting last week, we are starting to have a lot of this quote unquote demonstration protests against these orders that are in place. And I was curious by the law that you mentioned was passed in Korea that not only fines people that are violating these directives, but also there's a potential for 1 year prison sentence, right? So I'm curious to know your experience now that you've been there for a week or so, like how are people responding to that? Are there a lot of, sort of like negative sentiments against that, or people are generally on board with what the Korean government put forward?
So the international arrivals like me are must be under self-quarantine for 2 weeks. So which means that I shouldn't go out of the house.
Mm-hmm.
So people are usually doing well, but I heard that some cases that people just leave their smartphone at home, and because of the GPS track, so they just leave their phone and just go out of home. But I think somehow investigators know that they were out of home, so maybe they could track the CCTV or the use of credit cards. So yeah, there were cases that two international students were banished back to their country.
Mm-hmm.
So I think people are usually just doing well, but for some cases are, that in the news or media, they announce that there were cases like that, and they are very harshly blamed too by many people. So people are just worried about that. So that's why people are just keeping well, voluntarily.
Thank you.
Jan, yeah, you're up, I think.
Hey, Jin, this is Yan. Thanks, Dr. Milton, for giving me the mic. Really great, fantastic presentation. We're all devouring any information that we can get on COVID-19, and I think this has probably been some of the most useful coverage, quote unquote, that I've heard in a long time. But I had a question as we're talking about privacy. I just kind of wanted to know, has the internet figured out who patient 31 is yet?
We actually don't know who she is, but yeah, we only know about her, as I presented, we only know about her age and gender, and that's all people know. So not yet, people haven't figured out who she is.
Okay. And do you know of any other kind of more, just in a practical sense, I'm wondering if the full identities of any of the patients have been kind of released at a wider scale than is intentioned by the government reports? Has there been any kind of specific revelations in terms of cases to the public, or that the public has gone on their own to figure out?
People didn't, mostly people were not against the decision to publicly share the information, because as I mentioned, after the Mers outbreak, the government didn't share the information which hospital had cases, and yeah, the information about the patient or the location history. So yeah, people recognize that the sharing the information is more important to keep the safety of for the population. So I think there were less, people were more likely to support that bill because we experienced the severe outbreak of MERS.
Gotcha. Thanks.
Catherine, I can see you on the chat, and would like to hear what your perspective is, given that you know a little bit about Korea, it sounds like.
So it's kind of misleading to say that I have a perspective about Korea, but I do have relatives who live there, including my brother and my father's direct relatives. So I can give a little insight on what's happening on the food industry side. So for the people who might not know this, in Korea, food delivery is such a big part of the Korean culture. And there's so many apps, think Postmates, Grubhub, and things of that sort. But it's on it's much larger and on a much larger scale than it is here. It's much more convenient. So I think that even though there was a very massive impact to the food service industry in Korea, especially Seoul, it probably wasn't as big as the impact that the pandemic has had in America. But I wanted to ask Hyeonjin, thank you for the presentation, by the way. So my sister, just to give a little backstory, my sister is an internal medicine doctor here in America, in San Francisco. And she's mentioned to me that a lot of the people might not understand that in hospitals are losing a lot of money in this pandemic, even though hospitals are being overrun, because most of the money that hospitals make are from elective procedures such as heart surgeries or spinal surgeries and things of that nature. So because America has such a different healthcare system than South Korea, to my knowledge, South Korea has a universal healthcare system. So even though Korea has a universal healthcare system, I do know individuals in Korea who have maybe a private practice that are still losing money because of the reasons that I've been saying, like a lot of patients aren't coming in. So I wanted to ask you what has been your experience on that front, if you know any doctors that might have been affected in terms of the business side.
Actually, I haven't heard because I have no doctors around me. So yeah. So do you mean that for some doctors benefited from the COVID-19 in Korea and some doctors didn't?
I'm more concerned about, so I'm not really knowledgeable about the Korean healthcare system. So I guess if I could rephrase my question, could you explain how healthcare works in Korea, if there's a copay, and then how it also works for immigrants maybe?
Well, actually, I don't know much about the healthcare service yet. I think I need some research on that. Yes, in terms of just based on my experience for the healthcare service, because yeah, it's usually covered by the national health insurance. And for my case, when I had a test for COVID-19, it was free for me because it was required for me to get a test because I'm from the overseas. But I heard that some people, if they just want to get a test or based on the diagnosis of the doctors, they have to pay like $100 for the testing, and it differs for the health insurance or not. So yeah, that's what I know about the health insurance.
I've been hearing a little bit about Taiwan's system, and they have also had this sort of radical information. What was the term that Jessica was using?
Radical transparency.
Yes, the radical transparency. They also have a centralized national health service, and so they are able to leverage that to identify all the people with potential diagnoses and make sure that they're getting tested within their healthcare system. It was actually designed from the ground up by a professor in health policy and management at Harvard School of Public Health. And so it has, they've been able to leverage that in Taiwan. I don't know anything about the Korean healthcare system. But yes, the current market business model for healthcare certainly creates a vulnerability, both in terms of the finances of the healthcare system, and we're hearing about doctors and nurses being laid off at hospitals because they're losing money because they're not doing elective surgeries on the one hand. And on the other hand, it means that it's very difficult to have the surge capacity because the surge capacity is a net loss on the books of a healthcare institution. And that's a really a whole interesting topic that perhaps our HP&M folks are doing seminars about, but I haven't looked. It's after 12 and we didn't get to all the questions today. I'm sorry, but I appreciate everybody joining in, and I think we had a wonderful session today, and I look forward to further discussions as we go on for a while with this thing yet. We're not out of the woods. Thank you, everybody.